So we're going to carry on in this video by looking at other ways in which diseases were treated in the medieval world, specifically the medieval England. And we're going to talk a little bit about physicians, and then we're going to move on to the different ideas of hospitals, and then we're going to look at some ideas behind surgery. Okay. So I've already written some notes up here. What we've got here is that by 1300 there were only around 100 physicians in England. This meant that they were in very high demand. Okay, so we've got about how high the demand was here due to how little there were in the country, which led to them being able to charge high prices. They were very expensive. And I want to really put an emphasis on the kind of training that the physicians would have. So they were trained at universities, specifically Oxford and Cambridge universities, and they would read a lot of ancient and Islamic texts. So for example, they would read a lot of Hippocrates and Galen to really get all of the current medical knowledge that existed at the time, and to really become really well versed in medical language and the medical knowledge. However, what's important to note is that they did very little practical training, i.e. they didn't go out and practice on real people and practice their skills. They just learned from a book, or they learned from texts. Okay. Now this is very different to modern day physicians, obviously, as we can tell, and it's important to note that all they really knew to do was to just reiterate the practices of these ancient and Islamic medical intellectuals. Okay. So if we move on to hospitals, again, these were also in very high demand. Okay. So they came mainly from the church due to the fact that the church was a very powerful institution at the time, and they were very popular because there weren't many in the country. There were few and far between. Okay. However, what is important to note here is this point here, is that hospitals didn't really even treat diseases, but they cared for the sick and elderly. Okay. So they didn't, the practices like bloodletting and prayer and repentance, they didn't really practice these in hospitals. They just practiced caring for those who are sick, which it could be argued in some cases would be, quite an adequate treatment. However, in most cases, probably not. They were relatively hygienic for the time. So we're going to talk a little bit as well about how, in the next video, we're going to look at how monasteries were really important in the medical world at this time, due to the fact that they were so hygienic, which is also why they acted sometimes as hospitals. They sort of, again, treated and cared for the sick and the elderly. Most people, however, chose to be treated at home, to use these ancient remedies, or to maybe use these more mystical ideas like bloodletting and, miasma and all these kind of things. Moving on, we can look a little bit at surgery. Okay, now surgery was not very popular in the medieval time. So, partly due to the fact that there was no real belief that centered around surgery. So, for example, the four humours theory and the miasma theory didn't really create a need for surgery. So, therefore, it was less well known and less popular. However, things like amputations did come from the Islamic world. So, it was a thing in medieval England. However, there was not really any way to prevent blood loss, infections, and the main one being pain. Okay, so they would use quite crude tools to cut people, to maybe cut amputations, and there was no pain relief. So some people may even have just passed out and gone into shock from the pain themselves. Other people died from infections later on, and in other cases, people died from blood loss at the time. And these surgeries were performed by what were known as Barber Surgeons, okay? And their job sort of came into the world and carried on through the modern world and just turned into the regular barber, because at the time they did used to also cut hair. Okay, so they would cut hair and they would perform surgeries. So effectively they were seen as cutting bits off people. Okay, and with this you might think that there wasn't really many proper advancements and progress made in surgery. However, there was, if we look down here, a number of ideas that were developed in the 13th century, okay, 13th century and the 14th century, okay. So we have Hugh of Lucca and his son Theodoric, who worked as surgeons in the early 13th century, and they worked as surgeons in the early 13th century in Italy, specifically, okay, and they worked in Italy in the early 13th century, okay, and they, unlike what we've seen over here with the lack of practical training, they did recognize the importance of practical experience rather than simply reading the texts. Okay, I'll just get rid of that so we can see the actual text here. For this reason, they actually began to question some of the ideas of Galen. Specifically, if you simply just read all of the texts by these people, the more time goes on, the more people learn about medicine, the more people are going to get their ideas questioned. And they came up with a number of ideas anyway. So their ideas, for one, they came up with the idea of dressing wounds with bandages in wine. Okay, so they'd have bandages that were dipped in wine, and that would be used to dress the wounds. This turned out to be a good way of keeping wounds clean and preventing infection, and it was a discovery that was made by chance. So they just made this discovery by chance. They just thought, let's throw some wine onto it, let's see what that does, and that led to a drop in infections. Okay, they also took a different idea into consideration when it came to different views that were about during medieval Europe. So, for example, we see the idea of pus. Now, in most medieval circles, it was seen as something that was relatively healthy. Okay. However, these two took it and turned it on its head and suggested that it wasn't a healthy sign, which in most cases, almost all cases, is true. Okay, I'm going to put that in square brackets and just reiterate that this is almost all cases. This is true. Okay, and so they were correct about that as well. And all of these works were published by Theodoric himself later on in his life. Okay, so people were able to learn from these ideas. Okay, and specifically, they believed that pus would release toxins from the body. Okay, so therefore, releasing these toxins out of the body if they were able to get rid of it. So we move on to another surgeon, another medical academic at the time, who created a recipe for anesthetic. Okay, so we have John of Ardern, who created a recipe, and he did this in 1376, and he did it obviously to reduce pain. Not much is entirely known from this idea, the recipe itself. We do know, however, that it was made of hemlock, opium, and henbane, and possibly other different recipes, ingredients. Okay, and it was a relatively modern advancement in medicine. However, it was seen to kill quite a lot of people. However, this wasn't because of the fact that it was in some way poisonous or toxic. Well, I guess in a way it was. However, it was used in the wrong doses, so they used wrong amounts for people. They often, gave them too much, so they didn't control the doses very well. And when they started to carefully control doses, it created room for people to genuinely use it as an anesthetic to reduce pain. So that concludes our little two-part video on how diseases were treated in the medieval time. This really does bring about everything that we've come across so far, and it puts it into perspective. It also brings in new ideas, specifically ideas around surgery and hospitals. And it also tells us about the way almost the medical industry existed at this time, the fact that there was a lack of physicians, the way they were trained and what they were told to do when they were trained. In the next video and the video after, we're going to start bringing the medieval period to an end and moving on to a later part in history of English medicine.